And opposition has 6 minutes to state their case and come up here if they like. If we can make some room, or there's some chairs here on the side. After that 6-minute presentation, we're going to ask those that are in opposition to just state your name and position. Keep in mind that this bill was heard in Governance and Finance, dealing with the land use issues. This is the Health Committee. If we can try to keep our comments to health and health issues, because the other issues have been already addressed in the prior committee. Anyway, please proceed.
Natasha Minsker, ACLU of California. Regretfully, we continue to oppose the bill. The objection we have that's relevant for this committee is that there continues to be language in the bill that purports to allow local jurisdictions to completely ban individual patients from possessing and cultivating medical marijuana. We believe this is inconsistent with current state law and also just simply not good policy and not what the voters approved of when they approved the Compassionate Use Act. There is one appellate decision which recognizes the ability of local jurisdictions to ban all personal possession, including by individual patients, of medical marijuana. We believe that appellate decision was wrongly decided, and we are actively challenging that case through separate litigation, challenging the existing bans in Fresno City and Fresno County. And so we would urge further amendments that would limit the ability of local jurisdictions to ban possession and cultivation, and specifically only apply those bans to commercial activities. We appreciate the author's efforts in this matter, and we'll continue to work with them. Thank you.
Mr. Chair and members. Thank you. I'm Lisa Seelan. I'm a partner in the Seelan Law Firm, and our main practice is representing marijuana cultivators and dispensaries, primarily in the city of Los Angeles and parts of Southern California. We're in full support of a regulatory and taxation scheme, but we really want to make sure that the bill will provide the safe access and affordable distribution of marijuana to patients in need. The mandatory distributor model looks like it will put a kink in this particular thing, because the current marketplace is a vertically integrated model where cultivators, dispensary owners, and distributors are all acting as a single person. The bill does not allow a cultivator and a dispensary owner to be a distributor, which will probably put a stop to getting the medicine to the patients in need. This happens to be a current utilized method by the BOE for regulating tobacco in California, so it is a method that's out there. The other thing that concerns us is the cultivation square footages, because again, if there's limitations to the size of cultivations, whether they're indoor or outdoor, which is arbitrary today in our society because there's no statistical background, it could prevent a shortage of medicine to the patients in need. So that's another thing. We would like to just do away with all license classifications and allow there to be no square footages. And then the other part is that we would like there to be no qualification of dispensary licenses, because dispensaries should be able to cultivate for their patients like they always have. And there's 2 different classifications, which is very confusing. Lastly, we feel that by carving out Los Angeles, which is the biggest medical marijuana market in our state, we need to amend to make sure that as soon as Los Angeles amends or does something to the Measure D, that there is a pathway for them to go right into the state regulation and be able to be licensed like the rest of the state. And in closing, I want to thank all the drafters of this. I think it's an amazing bill. It's very concise and a lot of work, and I want to thank all of you, and we look forward to working together to make some of the changes that we feel will be beneficial to the patients. Thank you.
Okay, anyone else in opposition?
Okay. Michael Green on behalf of the Fresno Cannabis Association. Local control and effective state regulation don't go together, and there's a whole lot of all-in on local control here. Everyone in all of your districts have multiple dispensary bans. You have outdoor cultivation bans. In Fresno County, we have a total ban on all dispensaries, all cultivation, indoors and outdoors, and you pay a $1,000 per plant fine for violations. And they also go after property owners for violations. The biggest pipe dream and the biggest problem with this bill is local control. We do have case law on that stems back to SB 420, which did allow for local control up to the point of banning all types of businesses. I asked this committee, as a health committee, as a healthcare delivery system, the idea of allowing local jurisdictions to ban the distribution of medical marijuana that is provided by state law is the big elephant in the room, not just in Fresno County, throughout most of the Central Valley, throughout most of the Inland Empire, and in all of your districts, bans are the law of the land. AB 26 will not only not address that, it will encourage the passage of other bans as we look toward legalization in 2016. We support many of the provisions in this bill, but the big elephant in the room are the local bans that harm patients in Fresno County and most of the Central Valley, and we would ask you to consider that. Thank you.
Please proceed.
Thank you. My name is Shona Gokenar. I'm the director of Access of Love San Francisco, a patient advocacy organization for low-income patients. We are opposed until compassionate amendments are added. While we appreciate the efforts to have the task force work with the patient groups, most of this is focused on the bans, but I would add to the conversation of the bans that the largest ban is statewide, and it's equity for low-income disabled patients to be able to afford their safe access. Currently, most low-income patients and people that are terminally ill are only able to window shop at many of the dispensaries. We need to have a specific advisory committee to review and report findings for a statewide mandate. We do not have to reinvent the wheel. We have the cities of Washington, D.C., Berkeley, and a resolution that our organization worked with the San Francisco Board of Supervisors, and now our Planning Commission supports the permitting of MCDs or medical cannabis dispensaries with the provision that they have a program for low-income, terminally ill veterans and our elders. And, you know, I appreciate the collaborative effort here, and low-income patient advocates would like to be a part of that, and I really appreciate all the work that's gone into this. Thank you.
Thank you. If we can just have the remainder of the individual, just please state your name and position. Thank you.
Lynette Davies, Crusaders for Patients' Rights. We're opposed until amended.
Craig Barish, California Cannabis Coalition, representing 412,000 California voters. We oppose.
Rick Fenton, one of the proponents on the Compassionate Sensible Access Act. Opposed unless amended.
Debbie Tharp, another proponent on the Compassionate and Sensible Access Act. Opposed unless amended, and I would like to add a time limit to how long Measure D has to change its ordinance, at least a year.
Julia Carrera, Small Farmers Association, the self-regulating cultivators of the North Coast. Thank you, authors, very much. We are opposed until amended because cultivators can no longer process on their farms, which they have been doing for over 40 years. Thank you.
Rich Miller, Health Education, Legal Patients' Rights, and American Alliance for Medical Cannabis opposes this bill unless amended as stated by the ACLU and the other people up at the podium. Thank you.
Hi, Sandra Bacon, representing the disabled retired veterans, and we opposed until it is amended for compassion, and also I'm an Access of Love.
Good afternoon. My name is Gregory Ledbetter. I represent Black and Brown Just Cannabis Policy, San Francisco, hundreds of low and no income patients of color, and we oppose this this bill until amended as well.
Good afternoon. My name is Jonathan Dyer. I am from Access of Love, and I am opposed to this bill unless it is amended for indigents. Thank you.
Hello, Richard Bates, patient advocate, and I'm opposed until amended. Thank you.
Hi, Senator. A. John Martinelli here, compassionate baker who continues the tradition of Brownie Mary for real. And I've been using medical cannabis since I was a teenager for my condition, and I was an outlaw until 215 was passed in 96, and I don't want this new ordinance as is. It would make me an outlaw all over again. Please consider the amendments.
Thank you. Any other questions? Senator Nielsen.
Mr. Chairman, I'm going to briefly walk through the bill, and I'd ask the authors to listen up. I don't know if these are appropriate amendments or not. First of all, let me observe. I have not been a supporter of marijuana, period, 215 or anything else. In the 80s, Senator Presley, a very respected colleague, carried these legislative bills. They were related to terminal illness and glaucoma. And then they never made it. And finally, we're at where we're at today. And we have kind of a confused situation. The areas that I have represented, and that includes 19 different California counties, have had a huge problem with this cultivation. And it's so out of control that it does argue for more control than we now have. Tom, my colleague here, and I both walked the beat in law enforcement. We have seen what we would call, I think together, I think I can speak for him, the light at the end of the marijuana tunnel. It is not pretty. So don't paint a picture that this is some kind of life-saving chemical addition to our lives. It isn't. Far more lives are ruined by marijuana than saved. But we might get to a point, I might get to a point of being yes, because right now is not satisfactory. 215 has not been repealed. I would like to see in this bill, or in following legislation, for sure though, a considerable tightening of the latitude by which doctors prescribe medical marijuana. I believe that they're taking incredible liberties in what they prescribe it for, making it almost a sanctioned sale. So I think that yet has got to be addressed. Just a thought here to the authors. On page 17, it would be line 19 and 20. You don't necessarily have to follow me through the bill, but just hear what I'm suggesting. It talks about, and I may be missing something, it says the Department of Fish and Wildlife shall promulgate regs for the protection of any species affected by cultivation activity. It would seem that that should be more specific, should say cannabis cultivation. So there's no confusion of what we're talking about cultivating here. It's not strawberries. The whole section in the bill applies to cannabis, so I expect that's self-evident, but that might be something that we could think of. I want to be very clear, and we have had witnesses here from the League of Cities and the rural counties. And I'm comforted by that because they, like I, recognize the severity of the problem. I will make a note, something that's fundamental in my feelings on this. In Butte County last year, the county passed a fairly restrictive ordinance. Folks who didn't like that tried to referend it and substitute their own. The people of the county overwhelmingly supported the county's more restrictive and rejected the less restrictive attempt. That gave me some indication of how the people of that part of the North State feel. And it's important to me that this bill does not infringe on those local authorities. Their testimony here helps me find comfort. It says on 27, the extent this chapter does not interfere with or violate health and safety code exemption. And that's mentioned a couple of places in here, so I gather that's what the authors really mean. Am I correct in that? And I also endorse a provision on page 36 where it says the intent of the legislature to further determine the suitability of applicants for licensure, prior felonies be considered, specifically cannabis. And ladies and gentlemen, that is important because we have some folks who are really in the business here. And we're going to have a lot more that want to get in the business as we take further steps. So I am sensitive to that fact. I guess this is just kind of a personal thing, and I confess it's nothing but a personal beef. But it says the Department of Food and Agriculture shall declare medical cannabis to be an agricultural product. Now, that may be the law with this bill passing, but I'm never going to accept that medical cannabis is an agricultural product. And I say that not even tongue-in-cheek. But getting back to the overall seriousness of it, folks, I do want to compliment the authors for a tremendous amount of effort in the bill. And it's been a hard thing to get me to yes on this legislation. But for the reasons that I have suggested here, and keeping in mind that I am mindful of the future, and I'm hopeful the people of the state of California get that this bill is a step now, that step, and we do not take any further steps with initiatives, as has been threatened. And if there is such an initiative, I'll be leading the fight against it, notwithstanding whatever we do here. But everybody's worked on good faith. This is a very tough and very difficult vote, and it's one of the ones that I've had to introspect a great deal and study a great deal before I got to where I'm at here today. So I thank the authors for a lot of good, sincere hard work.
Thank you. Anyone else like to? Senator Pan?
No, thank you so very much. Certainly I have my own skepticism about marijuana in terms of recreational use, particularly by adolescents. But this is really about people who can benefit from marijuana as a therapeutic agent. And I realize that, actually some research on that could actually has been limited partially because of the nature of the restrictions on that. And that's why CMA has policy around that as well. But one of the things is that in terms of being sure that we actually have a sensible medical marijuana system, we do need a structure, and that's what you're doing here. I want to applaud and thank all of you for doing that, because I think that's very important. There's a lot of different issues which you've tackled in this particular bill, and I think the absence of that for so many years has really put a cloud on the whole situation about people being able to get access to consistent medical marijuana and that actually being available as an appropriate therapeutic agent in appropriate places. And so with that, I would be pleased to move the bill.
I believe Senator Wolk had a question or comment.
I do. I have a question, actually. Mr. Bonta, I wanted to ask you if you would elaborate a bit on this issue of local control versus statewide regulation. We do know that 215 did pass and that people should have access, and I support the bill. But just if you could elaborate a little bit more on that.
Yes, thank you, Senator Wolk. We are trying to strike an appropriate balance here between creating some uniform guidelines throughout the state, a floor, if you will, of uniform standards that all those engaged in the medical cannabis industry must comply with, and also providing local control and honoring the case law that currently exists with respect to local control. Our read of that language is, or of the case law, is that bans by local jurisdictions are lawful, and that they do not violate the Compassionate Use Act. So that's one of the genesis of our current approach. There's also an acknowledgement of the patient access issue. And we took amendments suggested by this committee to help strengthen the patient access issue. The task force in the bill is now tasked with looking at best practices to ensure the greatest access to the most patients, and that's important. We've also included language throughout the bill that says, to the extent this chapter does not interfere with or violate the Compassionate Use Act, to make clear that we are honoring the Compassionate Use Act and acting in spaces where it doesn't go. So we think we have the right balance between state uniformity and local control. We think we are consistent with the existing case law. We also think we're making important and significant steps to maximize patient access.
Thank you. Seeing no other questions, we have a motion by Senator Pan. I'll just make a few comments. Again, thank the members for bringing this forward. Again, separating from medicinal use to non-medicinal. Obviously, for non-medicinal, I am not in support of that whatsoever. But the will of the people of the state of California have spoken. There's an initiative, and we have to follow that will of the people. As Senator Pan said, there is a certain medicinal purpose, and there have been scientific studies that show that. I mean, I personally would like to see it done through the pharmaceutical industry, dispensed through a pharmacy, but we're not there. So what do we do in the meantime? We have to deal with an initiative, we have to deal through a regulatory process, and we have to make sure, number one, that public safety and that fine balance, and that's why I obviously lean towards local control and allowing local government to finally make those decisions as well. And obviously that's why I'm supportive of the bill as well. So I want to thank all of you for the work that you put into it, and more importantly, the conversation we had earlier, that if there's a possibility, because there's a lot of bills out there, you know, there's still some other bills to maybe put this in the conference committee to figure out how best to get it resolved and get a signature by the governor. So with that, we have item number 4, AB 266, due pass to appropriations. Chair is recommending support. Call the members, please. Would you like to close? Sorry.
We've all said a lot, and I appreciate the robust discussion, and this is our second committee today. And most importantly, we think it's very important.
I'll take that as your close.
To, after 2 decades, have comprehensive regulations. Thank you for your consideration.
Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, no. Hall. Hall, aye. Mitchell. Monning. Nielsen. Nielsen, aye. Pan.
Aye.
Pan, aye. Roth.
Aye.
Roth, aye. Wolk.
Aye.
Wolk, aye.
That has enough to get out, but we're going to place that bill on call. And I believe you're going to do your next bill, item number 9. Is that correct? Yes. Okay. Item number 9, AB 533, Bonta, healthcare coverage, out-of-network coverage.
Thank you, brother. Mr. Chair, just to clarify, I'm also presenting today on behalf of Mr. Gordon, AB 339. I'm happy to take AB 533 first, if that's
Which one would you like to do first? We can do Gordon if you like first, or if are your presenters up here?
I think we're ready for 533.
Okay, then we'll go back to Gordon. We'll do 533 next. We'll do Gordon.
Thank you, Mr. Chair and members. I first want to start by thanking the Chair and committee staff for your hard work on this bill, and I am accepting the amendments offered by the committee. Thank you for those. AB 533 takes patients out of billing conflicts between health plans and insurers on the one hand and physicians on the other when the patient follows the rules about receiving their health care services, goes to an in-network facility for a procedure, and unbeknownst to the patient, an out-of-network provider participates in their care. Almost everyone has experienced, heard of, or knows someone who has experienced a surprise bill. These bills range from hundreds to up to tens of thousands of dollars and are pushing some consumers into bankruptcy. AB 533 takes the patient out of the middle of the dispute and requires the patient to pay only the in-network cost sharing, or in other words, the same cost that the enrollee would have paid to the physician for covered benefits if the physician was in-network. We have had many discussions with stakeholders on this important issue, and everyone on all sides agrees with the fundamental premise of the bill that patients should not be involved in these billing disputes. The current language in the bill accomplishes just that. The follow-up issue related to the first, though it is not the original primary intent of the bill, is to determine what fair payment is between the health plan and the physician. This is a thorny issue that requires a thoughtful approach, as there are many options to consider. We have been working diligently with the stakeholders on this issue, including DMHC and DOI, to determine a fair solution to this problem. The amendments the committee has proposed and we are accepting establish a simple back-end solution with the creation of an independent dispute resolution process that is mandatory and binding by both parties. The finer nuances and details of the IDRP will be established by the departments. This is a reasonable approach that will help address the issue of fair payment to the physician without compromising the care or pocketbook of the consumer. With me today is Tam Ma with Health Access California, the sponsor of the bill, and Betsy Imholtz with Consumer Union to speak in support of AB 533.
Good afternoon,
Mr. Chair, members of the committee, my name is Betsy Imholtz. I'm from Consumers Union, which is the policy and advocacy arm of nonprofit Consumer Reports. This bill will have a real impact in the real world to make consumers' lives better. We've gotten scores of stories from consumers who've been faced with out-of-network bills. Michael from Sebastopol is one example. He went into the hospital for a heart valve repair. He knew it was an in-network hospital. To his surprise, as he was recuperating, he got a $7,000 bill for an anesthesiologist he'd never met, but who performed services for him at the hospital. Another surprise was that his $7,000 bill didn't count toward his deductible. So in addition to the $5,000 of deductible he was expecting to have, he had an additional $7,000, leaving him with $12,000 of debt, twice what he was expecting to have. And he's not alone. Consumer Reports did a survey, a national survey of consumers and their experiences on these out-of-network bills. And in California, we had two key findings. 1 of 4 consumers actually experienced an out-of-network surprise bill from a provider that they thought was in-network first. Secondly, the majority of Californians expect that when they go to an in-network facility, they're going to be billed only for in-network charges from all the services that they've gotten there. 533 would address these problems and take consumers out of the middle of the negotiation issues between plans and providers. It covers the anesthesiologist you may never meet because you're about to go under the knife, or the radiologist who may be reviewing your images from the hospital, but again, you may never even meet them. Prior to the Affordable Care Act, medical debt was the #1 cause of personal bankruptcies. We certainly hope that's no longer going to be the case, and we believe 533 would help ensure that. Consumers Union strongly urges your support of this important measure. Thank you.
Good afternoon, Mr. Chair and members. My name is Tam Ma, and I'm with Health Access, and we are pleased to sponsor and support AB 533. Consumers generally understand that they can minimize out-of-pocket expenses by using in-network providers and services. Even the most careful consumers, however, who go to in-network hospitals and other facilities can end up being treated by an out-of-network provider and then receive a surprise bill for the difference between the provider's charge and what the plan is willing to pay. AB 533 holds these consumers harmless when they get care at an in-network facility by letting them pay the same copays and other cost sharing that they would have had to pay for in-network care if they get treated by an out-of-network provider. The bill, with the amendments that the author just took, also requires health plans to pay non-contracting providers the average contracted rate paid for the same services in the same geographic region. The bill also addresses a practical problem that non-contracting providers currently have when they disagree with what the plan pays them. Right now, these disputes over low-dollar but high-volume claims are litigated in court. AB 533 creates a mandatory and binding independent dispute resolution process to resolve these claims. The Department of Managed Healthcare currently operates a voluntary independent dispute resolution process, and we know they have the experience to set up a process that is called for in AB 533. We appreciate Mr. Bonta's efforts to protect consumers from being trapped in the middle of billing disputes between health plans and providers, and respectfully urge your support of this important consumer protection legislation.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. We're pleased to be here in support of the bill as well. We acknowledge for many of our members, this is one of the top issues that they hear from their consumers is the balance billing or surprise billing phenomenon. We think that this bill goes a long way towards addressing that. We've been an active party and participant in the negotiations and the discussions. We also think that the IDRP process, while noted in the bill, we'd like to continue those conversations about what that would look like going forward, as well as with our regulators to ensure that it's a fair and even process. But today we are extremely pleased to be here in support of the bill.
Elizabeth Landsberg with the Western Center on Law and Poverty in strong support of protecting patients from surprise bills.
Thank you. Anyone else in support? Please state your name and position.
Jerry Jeffy, representing the California Chronic Care Coalition, in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Jasmine Gordon on behalf of the California Black Health Network in support.
Sarah Flox, California Labor Federation in support.
Ann Donnelly, Project Informed California HIV Alliance, in strong support.
Maureen Higgins, representing America's Health Insurance Plans and Anthem Blue Cross, in support and echo the comments of ACLIC.
David Gonzalez on behalf of CAPG. We'd like to acknowledge the hard work of the author and his staff in putting these meetings together. We have a supportive amended position on the bill, but we think the conversations are going in the right direction, and we hope to continue those conversations. Thank you.
Michelle Cabrera with SEIU California, in support.
Dolores Strand Flores, California School Employees Association, in support.
Chair Member Luis Sanchez with Blue Shield of California. We had a supportive amended position in Assembly Health, and we really like to thank the author and the chair for the most recent amendments. We believe that it addresses a very important issue, and we look forward to supporting the bill. Thank you.
Autumn Ogden with the American Cancer Society Cancer Action Network, also in support.
Nick Luizos, California Association of Health Plans. I want to associate myself with the comments of my colleague at the Association of California Health and Life Insurance Companies. Thank you.
Good afternoon. Julianne Broyles here on behalf of the California Association of Health Underwriters. Happy to be here in support.
Matthew Lewis on behalf of CalPERG, California Public Interest Research Group, in support.
Mike Montgomery, Congress of California Seniors. We support the bill.
Kuldeep Pasagai on behalf of NAMI California, in strong support.
Kathy Ruzicka on behalf of AARP, in support.
Thank you.